There are many possible causes of abdominal pain, and the medical books and online literature will produce long lists of possible diagnoses whenever a patient presents with abdominal pain. But very quickly, when I see a patient, after a few minutes of the consultation, we can start to refine that list and come up with likely diagnosis, usually 2 or 3 in that patient. So after I've seen a patient, we can usually focus down on a couple of diagnoses. But essentially, any organ that's in the abdomen or in the tummy space can cause pain. So that could be the esophagus, the stomach, the liver, the gallbladder, the biliary tree, the pancreas, the kidneys, the spleen, the colon, the muscles themselves that are in the abdomen. So any of those have the potential, to cause pain. But the common causes that I would see at clinic would be peptic ulcer disease or stomach ulcers, gastroesophageal reflux disease, irritable bowel syndrome and functional dyspepsia, and then colitis and Crohn's disease. Depending on the location of the abdominal pain, that's one of the factors that really helps to narrow the list of possible diagnoses or narrow the differential diagnoses. So for example, pain, if it's more on the right side, the top right part of the abdomen, that can often point to a cause in the liver or the gallbladder. Pain towards the upper middle part of the stomach is often referred, or upper middle part of the abdomen often points to pain in the stomach, for example, a peptic ulcer. So yeah, the location of the pain is important, and the character and the severity and all of the other factors. So that highlights the importance of a good history taking during the consultation. Yes, so one of the most common diagnoses that I make at a gastroenterology clinic is of functional dyspepsia. So dyspepsia is the medical term for indigestion, and it covers all of the symptoms referable to the stomach, such as pain, bloating, gas, indigestion, reflux of acid, difficulty swallowing, all of those types of symptoms. And functional means when we investigate it, we don't find any abnormality such as an ulcer or inflammation or narrowing or anything mechanical. And this is a very common diagnosis. And then treatment relies on diet and lifestyle measures. And once we make a positive diagnosis of that condition, we focus on trying to identify diet triggers or lifestyle issues such as stress or anxiety that may be contributing to the condition. As a general rule, we say that if a pain or any symptom lasts for 4 to 6 weeks, then you should see a specialist. So that would be usually primary care to begin with, and then often GPs would recommend referral to a specialist. But the bottom line is that if a patient is concerned, regardless of the duration of the symptom, if they're concerned enough, then they should consider seeing a specialist, because often a lot of what I do is to reassure people after I've taken the history and the examination, to say, I'm not concerned about these symptoms because I don't think they represent anything sinister or worrying, but we do need to try to figure out what's causing them so that we could come up with a good treatment plan. The tests that are done are varied. So we often start with blood tests, and one in particular would be a celiac blood test, what we call a celiac serology, as well as routine blood tests such as a full blood picture, liver function testing, and kidney function tests. After that, we can do a gastroscopy, a flexible camera test to examine the stomach and the esophagus and first part of the small bowel, the duodenum, or a colonoscopy, a flexible camera test of the large bowel or the colon, or an ultrasound scan, so a jelly scan on the abdomen to look at the other organs, the liver, gallbladder, pancreas, and kidneys. Or sometimes I would recommend a CT scan or an MRI scan, depending on the particular circumstances. So there's any number of investigations that can be done, but obviously not every patient needs every investigation done. So a large part of the consultation is trying to focus in on what investigations in particular does that patient need to try and arrive at a diagnosis as quickly as possible.